So telehealth and telemedicine is the exact same thing. They are used interchangeably, tomato, tomato. Telehealth and telemedicine was actually created before COVID, but it didn't really get its launch until COVID happened and the world closed. It really pushed people to see their providers over video. And it's definitely useful for when you don't require or need to have in-person visits. Now, there's always going to be emergent situations. That is not what telehealth is used for. Telehealth or telemedicine is great for those situations that you would normally call your doctor or your nurse practitioner for. I need a medication refill. I'm not feeling well. I've been out. I need a work note. Things like that. It's also great for those patients that either are underinsured or don't have insurance. A lot of them are just cash pay, super reasonable, definitely cheaper than insurance. For me, like I charge per visit. I don't charge a subscription. I don't like subscriptions. I don't like tying people down to that. So I provide a fee for service, meaning when you need me, you let me know. If you need me today and you need me in 6 months, then we have the consultation. That's when we will have a fee incurred. And that's just the way that I feel about things. If you don't need me, I don't feel like I should charge you. Also, it's good for if you want to get your labs done, you want to see how you're doing. So you're in charge of your own health. And I want and encourage patients to take charge of their health. So if you say, look, I haven't had labs done in however long, I want to see where I'm at with my cholesterol, with if I'm diabetic, if I'm at risk for this or for that, I can definitely order those and then we can go over them once those come back. So it's not just for things that you would go in person for, but things that we can also not necessarily have to go in person for. The way that the technology is going, we actually can see patients for several things. I know now they're doing CPAP mask fitting virtually, and the virtual fitting is more precise than in person. Like technology is just, it's going crazy with this. But there is so many things that we don't have to lay a stethoscope on you to actually give you care. I can look at someone through a video and talk to them. Are they winded when they talk to me? Are they tachypnic? Are they breathing too fast, trying to catch their breath? Do they, what color are they? Are they pink? Are they gray? Are they ashen? So I can tell a lot. Of course, if they need to be referred to in person, then that's what we do. But I have to say, I rarely do that. I rarely refer someone to in person. But there is some things I can't do a pap smear over video. Okay. And nor do I want to, but nonetheless, most things outside of those few things we can do over telehealth or telemedicine. Just the important things are to make sure you find a reputable provider, use a reputable website. We have to make sure we're HIPAA compliant when we speak with you, when we record, when we chat back and forth. A lot of states require the initial visit to be a video. But in all honesty, the majority will allow just a chat-based back and forth. But your providers will let you know, whoever you reach out to, they will let you know if it's state required or not. So regardless of where you are at or the state requirements, you always want the option to see your provider because there's so many shady things out there today. It's good to go into this with caution. If I wanted to see my provider, can I schedule a video visit just to see them, just for your own peace of mind? And so that's definitely something you want to make sure that that's an option. Can I see my provider via video visit if I would like to? And if not, what is the best way of communication? And just make sure that we have all the information that we need. But telehealth and telemedicine, all in all, is a great way for you to get care where you don't have to go sit in a doctor's office. You don't have to, load up all the kids to get them there. It is super, super cost saving. A lot of times it's, cheaper than your copay. There is some of them out there that take insurance, although I think most of them are going to be cash pay. Again, fee for service or subscription. Make sure you know that before going into it. And, if you have any questions, you can always reach out to the team. I have a telehealth platform. It's called Hamilton Health and Wellness, and the website is www.hamiltontelehealth.com. And that is where you can go and send us a chat right away. It is all HIPAA compliant, and we'll be happy to see you. I actually see patients on video visit with a free consultation. You don't have to buy anything from me. If you just want to connect and say, what are your thoughts on this? Where do I go from here? I don't charge for that. I don't charge per chat. So I truly just want my patients to be well and have great care, because I've been in the hospital for several years, out of the hospital. Um, it's all a mess, as we all know. Healthcare is a mess. So that's what telehealth and telemedicine is. The number to reach out for us on HIPAA compliant chat is 407-550-5441. Just shoot us a text and let us know what you need, if you need anything, and we'll be happy to get right back to you.